I think that this drug really changed the landscape of treatment of myeloma, and all the trials basically adding monoclonal antibody to the current standard, whatever it was, were successful trials. So it means that adding MOABs to the standard of care, whatever it is at the time of administration, is beneficial for the patients. However, of course, there remain some unanswered questions because all the current trials that we run and that we have the data from deal with the patients that usually were not pre-treated or at least were not refractory to any of these monoclonal antibodies, whereas now the reality and the landscape is changing, and we will be eagerly waiting for the trials dealing with the patients refractory to those patients and the potential retreatment with either of these drugs. Because I think that this is an unmet need now, because after failing of CD38 antibody, the prognosis of the patients is very poor, and we have very few options to offer. And one of those options, of course, might be the changing to the antibody-drug conjugates, for example, which is a novel agents. Let's say the idea is not novel at all, but in myeloma field, the first-in-class drug used, Belantamab, Mafodotin, paved the way to the antibody-drug conjugates. And this is a very difficult drug, as I would say. It has striking data. The efficacy is very good, including the efficacy in very advanced and refractory patients. However, there is also significant toxicity that needs to be dealt with. And although we are really happy to have this drug available and in clinical trials and in practice now, we know that there are some limitations for the use of this drug, especially the ocular keratotoxicity, well known for Belantamab. And this is a key issue in some of the patients who, in case they experience it, the treatment frequently needs to be stopped and or even withdrawn at all. So these drugs are really of high benefit for all the patients, actually, but I think that there still are some limits that need to be overcome in the near future, and questions that need to be answered, like refractoriness to anti-CD38 treatment, and also I think the modulation of intensity of treatment with antibody-drug conjugates, especially Belantamab, which we know is sometimes difficult to handle.